Peace, family. You tapped into the DOA TBM. Don't forget to like, share, and subscribe for more content and updates. This one's so groovy, baby.
Okay. So yeah, they have all these statistics that highlight how all the risks for Black people are elevated, but we have nobody explaining why. So that's where there's this mistrust. Wait, why are you saying that you're looking at me and you're saying that just because I'm Black, I'm going to need a high blood pressure pill? Well, that doesn't make sense. Well, we're not explaining why some of these things are disproportionate. Okay. The other thing is, the darker your skin is, the higher your need for vitamin D, because you're not going to absorb it as well. We don't get enough sun exposure. In many of the countries where Black people are living, if they were still in sunny areas, they wouldn't have that issue. But now they're living in areas with all these fair-skinned people, so they need to supplement with vitamin D. And it's not just a vitamin; it's a pro-hormone. It triggers everything else in your body. So if your D is low, nothing else is going to work properly. Anyways, so there are lots of reasons why, and I feel like in medicine, we just have gotten so used to just prescribing a drug and not really explaining or educating people on why or how their body works.
Okay, can I ask a quick question, if you mind?
Yes.
Someone asked me, I'm skinny, and why do I have sleep apnea? Because sleep apnea is for fat people.
Interesting. Yeah, I was traveling one time with a group of people, and I said I lecture on sleep and sleep apnea, sleep disorders, and the lady said, I went to one of those tests. They said I stopped breathing 53 times. Damn. I said, oh my God.
That's severe.
I go, are you wearing a Cpap? And she said, no. I go, why not? I am not that old, and I'm not that fat. Wow. And so she was offended by that, because in her mind, there was a picture of what a patient with sleep apnea looks like.
Okay.
And we've done that in the media. Okay. We've painted a picture in the media of truck drivers or obese people as the ones that have the issues. Okay. Children can have sleep apnea. Teenagers have sleep apnea. Anybody can have sleep apnea because there's so many mechanisms involved. If we're talking about the size of our neck, this is a great topic, especially for your group, okay? Because the size of our neck does correlate with our risk for sleep apnea. So you have some of these athletes who have just pumped out, and they've just got their neck, so broad, and they're so proud of that. But I guarantee you, when they go to sleep at night, they're not breathing properly. Because the muscle you see on the outside, you're also going to have that muscle on the inside. And then you go and do a workout and you engorge those muscles with blood. You're pumping iron, you're getting those muscles built up. There's research that shows they will sleep terrible after that. The same is true for fat, for weight gain that happens. It's also true for fluid accumulation and inflammation. So we know that. Where we have more of a difficulty understanding it is when we see the skinny people. So what we're looking at now is the anatomical size of the neck and the correlating size of the airway that goes through that neck. And for many people, their airway is the size of a straw. Wow. Right? It's the size of a straw. If you have these really tiny people with these anatomically skinny necks, they don't have much of an airway. And the other thing that we look at is the measurement. Okay, so if you take somebody from the side profile, you're looking at the measurement, let's say from their ear to the back of their head, and then you're going to look from the ear to the front. And what you want to see is that there's a good broad expanse there to allow room for a nice wide airway. When that area is tiny and compressed, you have to think of the underlying structure. It's going to be tiny. So now you take somebody who's skinny, maybe you're looking at hormones. So progesterone is really good for sleep, estrogen, not so much. Our culture, we have estrogen dominance, so that can trigger people. Women around their period might have some issues with sleep. I mean, there's lots of factors. So when I say that, sleep, I can paint out the picture for you of sleep. I can draw what it looks like.
Yeah.
But it's just like diet in the sense of you and I could eat the same food. I could react differently to it than you do. Right?
Right.
I might have more acid in my stomach. You might have less. I might have an intolerance to gluten or lactose. You know, you might be fine with cheese, for example. So when it comes to sleep, we know what the structure looks like and what is supposed to take place. But then there are all these variables that people bring to the table that in just talking with somebody, they'll paint the picture and you'll be able to see really quickly what's wrong with their sleep, why it's not working. Yeah.
Well, I mean, I think that's one of the great things about this conversation. You've definitely helped identify a lot of different, parameters externally that add to people getting different forms of sleep and just the different ways that the function goes throughout it. You spoke about vitamin D sort of deficiency slightly as maybe as an adverse sort of effect. Do you think there's any correlation within like having maybe like low iron and do you think it could affect like maybe people's fibroids and stuff like that too? Because sometimes we see people have those issues and they say there's some correlation with just them sleeping as well.
So iron. So when I'm checking somebody for their sleep, we do blood work. We're always going to do the vitamin D, vitamin B12, and we're going to do iron studies to look at. We have to look at a couple things. One, do they have the right levels that they need to have energy through the day? Because it's a 24-hour cycle we're talking about. You have to have enough energy through the day in order to sleep well at night. If your iron is low and you're dragging, what we're going to see is changes in your sleep, and it's correlated also with restless leg syndrome. So people who have this uncomfortable feeling in their legs, cramps, all of those types of things, we'll see that in a low level of iron.
What about? I was going to say, what about people who bounce and shake their leg repetitively?
Yeah, exactly.
I do that sometimes.
Those muscles are firing, and what will happen over time is the joint that correlates to it, you might start to get some inflammation in those joints. So you might start to have pain in your knee, your knees or your hips, right? Because if there is no time when those muscles can actually just be paralyzed and repair, then you'll start to get damage. Yes. So, and then you mentioned about fibroids and things like that. Yes. So for women, there's lots of issues because estrogen dominance can lead to fibroids. Fibroids can suck up all the blood in your uterus, and then your iron drops, and then you have problems sleeping. You have bone pain, aches. It can be really uncomfortable for women, and that disrupts their sleep, and the cycle just gets worse. And we could end up with diagnosis of chronic fatigue syndrome, fibromyalgia. All of those are descriptions of the symptoms that people are experiencing. They're not getting to the root cause of why it's happening in the first place.
Well, it's interesting you mentioned the fibromyalgia because I was speaking to somebody the other day who's actually, suffering from it and stuff. Now, they say it could be stress-induced, but they can't actually make a definition point of where the stress came from in her case. And
and we discussed what stress is, right? I don't like when they just say stress.
Exactly, because it's sort of just like coming up with an option and saying, well, take these pills and stuff for it, but it's not getting to the root cause of it.
Right. So you could have some women that have like polycystic ovarian syndrome, let's say, okay, or where their weight, they put on this weight, and they might have some issues with some hair on their face. They might start to get this darkening around the back of their neck or in the creases of their skin, right? They're puffy. They're puffy. It's related to sleep. Their sleep is broken. The hormones, they have an excess and an outpouring of hormones that should be controlled. So you start treating their sleep, you start reversing those symptoms, you increase a woman's fertility. And there isn't any part of your body that can function properly without the sleep. But how many women go around out there overweight, puffy, feeling, having these feelings about themselves, and nobody is telling them let's have a look at your sleep and see what is sabotaging you from living your best life.
Yeah.
Okay, so like, can you explain what's the difference between sleep apnea and sleep disorder?
Good Lord. So okay, I'll show you. There's a course I'm teaching right now called Classifications of Sleep Disorders. There is a book that's about 2 inches thick, and it is called the International Classifications of Sleep Disorders. There are around 100 different types of sleep disorders. Okay.
Wow.
Sleep apnea, obstructive sleep apnea, is one disorder that falls under the classification of breathing related sleep disorders. Okay. So you could have central, you could have obstructive, you could have mixed, upper airway resistance, chain stokes. Like there's lots of that fall under that umbrella. Mm-hmm. So when I say to people, we need to address your sleep, first thing they think of is sleep apnea and the Cpap machine. And they say, I'm not wearing that machine. I don't even want to go get tested. And the problem is because that's what we have focused on. Mm-hmm. Whereas let's say you go to the doctor and they say, no, you don't need a Cpap machine. But there was obviously something that brought you to the doctor. Okay. Mm-hmm. You don't have energy. You don't feel like you're sleeping well. Who do you go to then? To see if it's any one of the number of other things that it could be.
Mm-hmm. That's
right.
Great point.
Yeah.
I mean, that's a great point because not to put too much of my personal business out there, but I went to see the doctors not too long ago, and I was saying to him, dude, I don't come to these places all the time, so if I come here, there must be a reason I come here. You have to try to have that conversation with him and stuff. And as you said, sometimes I think professionally things are so difficult. He was telling me after we sort of had a bit of a disagreement, he only has, I think, 4 minutes or something to see people. And see, he was trying to sort of rush me to give him my ailments and stuff. And I'm saying to him, dude, it doesn't sort of work like that. And then we kind of had a bit of a backwards and forwards. And then I said, maybe if you would have started the conversation that way. But he gave me the time in the end and we had a bit of conversation. But like you said, I don't think he delved too much into, other stuff that I was probably going there with. He was more just thinking, okay, well, let's just sort of label this side and do this like that. And so sometimes it's good to be able to do your own research, which is one thing that I definitely always commend Randy on, because he's always, been an avid researcher into health and fitness and well-being and stuff, and continues to do that and share that information with others and stuff too,
Because one thing I tell people all the time, and you could probably explain, because this is like a mystery word for people. Tell them about the tether tongue. People think,
I've heard you speak on that, and sometimes when Randy tells me some of this stuff, I'm thinking, I know people with it, and sometimes I think I may have. So yeah, I'd like to hear you have to speak on that, the tether tongue.
So there's a couple of things. One, back in the day, midwives used to have one long sharp nail. Okay, that they would have this long sharp nail. When the baby was born, they would reach under the tongue, and if there was anything tethered there, they would slice it. Okay, so that the baby's tongue could be free to latch and nurse, etc.
Okay.
So there's one theory there. Then we have seen, and I'm just going to tell you the theories that are out there, okay, of why we're seeing this more and more. There was a worry about spina bifida, and so there was an increase in recommendation for folic acid. Every pregnant woman's got to take folic acid to close up the connective tissue around the spine, so you don't have a child born with spina bifida. Yeah. When you take something that's going to constrict connective tissue, you can't decide where it's going to go and do that. And so what we see is some constriction in the fascia or the connective tissue that is involved with the tongue. And then as time goes on, if you are a mouth breather and you allow your tongue to sit just low, you don't have your tongue pushed up into your maxilla or your upper jaw, over time, that tissue will become more and more restricted and tight. And you may have to exercise to stretch it out, or you may have to get it snipped to release it.
Oh, wow.
So the reason why is because our tongue actually is so important to everything. So after your heart, your tongue and your brain are the things that start in utero to create the rhythm in your body. And you need to be swallowing, your tongue needs to move. if I was to dissect out your tongue from your body, it is connected in one fascial plane, they call it, one piece of connective tissue from your tongue all the way down the front of your body to your big toes.
Wow.
So when we start to look at people and they're having problems with their gait, with their walk, their ambulation, you've got to look and see, where's their tongue? If they're bet you their tongue is not up in the roof of their mouth. So tongue is super important. You'll start to see teeth changes. You start getting crowded teeth. Your kid needs braces. There's the reason why your kid will need braces, because the tongue is not where it should be. The muscle of the tongue pushing up and forward, and the lips being closed, and the cheeks on all of those muscles, that is what guides the growth of your teeth and your jaws, and there should be more than enough room for everything to fit. So whenever you see that starting to break down, you got to look. The other thing is up here. You got to look under your lip, around in your cheeks. You got to look to see, is there anything that is restricting the forward motion of your face? So you'll see in a little kid, when their teeth come in, if they have a gap between, you want to lift up their lip, and you're going to look to see, is it too tight? You know, so there's lots of things about the tethered tongue, but you think about the size of the tongue, all you see is a little bit in the front. The bulk of it is sitting in the back. The tongue is actually really large.
Yeah.
If the tongue can't get up and forward, then that means it's sitting back in the back of your throat. So when you lay down to go to sleep, it's falling back and it's blocking out the airway. You get that tongue released, however you're going to do it, myofunctional therapy, frenectomy, laser, whatever you're going to do. And then you train it to go up and forward and get out of the back of the throat, so that when you go to sleep, it's not falling back.
Wow.
Do you think that's why so many toddlers die in their sleep, because the tongue goes back in the throat when they're laying in the bed?
So there's research that shows, for example, SIDS, okay? 92% of babies that die from SIDS had a restriction. Okay, had a restriction. It's really important in the baby. The baby is, you know, you've seen the pictures where the baby looks like a little creature, right? That unfolds.
No.
So those layers, as they unfold, need to be free to open up. If there's a restriction, well, that restriction goes all the way around the brain and down the front to the diaphragm. So now you're going to have a restricted ability for that baby to breathe. When we look into toddlerhood, we have to be really careful about bottle feeding, pacifiers, sippy cups, anything that's going to change the natural function of the tongue and the mouth. And then, you know, giving them mush food, pablum, all of those types of things, we're making the problem worse. But SIDS is the equivalent to OSA for babies.
I mean, with that being said, just a couple of more questions on that, the tethered tongue note. One being, you know, as we just mentioned it, then how it could affect babies and toddlers. Would you say it's something that could, you know, adults could be worried about, that it's something they could, if they sleep on their backs, maybe it's something that they could actually, you know, die from and stuff as well? Or do you think it's not?
Absolutely.
Okay.
Absolutely. If you look on any sleep test, you know, what you'll see is there's an increase in this sleep apnea or cessation of breathing when people are on their back.
Okay.
So a lot of what we do is called positional therapy, which is to support you sleeping on your side. And, you know, as a young person, your body is amazing for adapting and compensating and all of those things until it can't anymore, right?
Of course.
So that's it. My daughter, she just turned 27 yesterday, and she's going to go get her tongue tie released.
Really?
We have an appointment next week. Yeah, because we've done all the stuff that we could do, but at the end of the day, you know, hers isn't severe, but it's enough that she's constantly complaining of her neck. She's also always wanting her back cracked. Can you just, you know, she's always
all of that stuff. Yeah.
Yes.
Do you think so? I'm guessing there's a link somewhat between that and snoring and stuff as well. And the other thing I was going to ask is, like we mentioned the tethered tongue, and you mentioned some people potentially having a, you know, restrictive airwaves and stuff. Do you think stuff like this can be hereditary and stuff as well for like if it could be passed down and stuff, like heredity and stuff.
So it's interesting because I hear that all the time. Oh, it's genetic. You know, I have diabetes, it's genetic. My mom had it, so I have it. There's a term we need to get more familiar with using, and that's called epigenetics. And epigenetics means there are environmental things that can change it. Our genes can turn on and turn off. So, for example, we know that people who sleep 4 or 5 hours a night, there are around 700 genes in their body that are affected. Half of them turn on and half of them turn off.
Oh, yeah.
And right, so those can lead to a decline in your health very quickly. Once you understand how to turn on the right genes and turn off the wrong, you know, the ones that you don't want, then you can do it. Now, when we talk about genetics, the other thing we have to consider is that our brain has what's called mirror neurons. So I know Randy's going to write that down and look it up, and you'll all learn about it next week. Mirror neurons are what, you know, a baby looking and gazing into their mother's eyes, their father's eyes, will watch and mimic their facial expression.
Right. Yeah.
So we've all seen, you know, where you stick your tongue out to the baby and the baby sticks their tongue out to you.
Of course, yeah.
Okay. Somebody yawns. Oh, you're fighting not to, you want to yawn. We have these mirror neurons and we mirror people. So when you're growing up in your family, you are mirroring facial expressions.
Of course,
and
yeah.
Okay. If you as a parent are a mouth breathing person, okay, your nose is always stuffy, you've got postnasal drip, you've got allergies, your sinuses, whatever, you're mouth breathing, your child will learn to mouth breathe.
Okay.
If we want to change or correct that in our children, we have to start with ourselves to change that. Interesting side note, I don't know if I've asked this before to you, but when we think about the nose and the sinuses, how much fluid do you think that your nose produces every day?
Right. Yeah.
Question. I don't know. We talking in what units?
Let's say ounces.
Oh wow.
I don't know. I couldn't tell you.
How? Yeah. I don't know, quarter ounce or something. I don't know.
So we tend to think that the nose doesn't produce very much, and so if we have fluid, we automatically think it's a problem. Okay, your nose produces a liter of fluid, so a liter would be like a pint.
Okay, I was gonna say liters before, but
of fluid every day. And then if you are triggered, if it's hay season, if you're sick or whatever, you might produce 2 liters. But for some people, they don't like the feeling of anything back there, and they automatically assume it's a problem and pathological, right?
Right.
I know I got off topic. That's not what you were asking, but I was just...
it ties in. It's definitely it's amazing. So where does all that water go? Because it's not all streaming out from the outside.
And so it's stuff that you swallow. So when we talked about the brain, and REM sleep and non-REM, and we said that in deep sleep the brain waves get really slow, not much blood flow to the brain because it's all going to the body. Then you switch to REM and there's increase in blood flow, increase in activity. The cells of the brain suck up more fluid, they fill. The brain is fixing itself, clearing out emotion, all of that neurological debris, everything it took in through the day, through your eyes, your ears, your skin, your nose, all of that stuff, dealing with it. And then you switch back to deep sleep, bam, all of that fluid comes out with that neurological waste, and it has to go somewhere. It's eliminating. Just like we talked about how your bowels eliminate your food. Yeah. Your brain eliminates it, takes it all, pushes it through your lymphatic system to the base of your nose. There's a gland that is there. It enters your lymphatic system. It gets dumped into your intestines and you eliminate it out your bowels just like you do everything else. Right? But it has to go somewhere. Yeah. When you see somebody coming with this fluid, do you ever see those people that have like this roll? It looks like a soft jelly type of fat under their neck. Yeah. Right? Some guys, you see even on the back of their neck,
the back of their neck, the big ones and stuff. Yeah.
So that tells you that their flow is impeded for whatever reason. Their neck may be off, their jaw might be off, their tongue might not be up. For some reason, that fluid is not being eliminated properly.
With that being said, just quickly on the elimination of fluid then, because I know we will have some that will probably ask, is it regular for them to eliminate any kind of fluids in the morning and then after like a good night's sleep? Straight away, is that sort of regular? I know it's hard to say for everybody, but...
So are you talking about...
like in the morning, getting up in the morning, having a good, excretion or whatever, getting rid of waste process.
So you think about all night. So in the non-REM part of sleep, your intestines are very active, digesting food, taking nutrients, pulling what your body needs. So it's really active. And then in non-REM, it rests so it can heal, and then it's active again. So if your circadian rhythm wasn't working properly, you'd be getting up all night to go to the bathroom. Okay. But around 9 o'clock in the evening, your body shuts down the elimination part. So when you first get up in the morning, it all turns back on again. It makes perfect sense that upon wakening, you should go to the bathroom and have an elimination. Okay. Or, within an early part, yes. Yeah. And then throughout the day, you want to make sure that you keep eliminating. There's some recent science that just came out that identified that during the day, certain parts of your brain take turns sleeping if they need to. Oh. So if you have a really stressful conversation with somebody, you've probably all experienced that, where it's just really emotionally stressful and you feel like you almost zone out.
Right, yeah.
Right? It's because that part of your brain, like you're almost like, I'm done. I can't talk about this anymore. I'm done. It's that part of your brain actually will go to sleep, deal with it, clean it out, process it, and then eliminate it so that you can function. So we're starting to learn more and more about the brain's ability to turn off, turn on, and fix itself, even through the day.
Wow. No, that's amazing. And you definitely given us a lot to think about and stuff as well. I mean, Randy did say at the beginning that you got to blow out minds with some of this stuff.
I'm just glad somebody will listen.
Yeah. Oh, this is very important.
Yeah. I mean, I know you had some other fan questions. Did you have any more fan questions, Randy?
I have one more. Okay, and this is the most important one, and I think this is the most important part of all entertainment business. How does depression and sleep apnea come together in the music industry?
So depression, I would even say depression and sleep. How does it come together? When we talked about broken sleep is going to lead to depression. So this is where people who recognize the value of their client, their entertainer, their star, should also plan for and make sure that there is adequate window of opportunity for sleep. In the entertainment industry, there's so much pressure put on people. Social media and the world around can be brutal. The person, we forget sometimes that they are human. They're just human. They're like you and I. Their feelings can be hurt. They are just trying to do a good job, and they have all this pressure. So that pressure creates this hypervigilance, which when as much as they want to go to sleep, their mind might be racing, thinking about everything. And some of it could be very positive and very exciting to have a new contract. I've got a new album coming out. I hope people like it. There's all of those things. Excitement and anxiety are two sides of the same coin. They both are the same effect on our body. So learning to say, I'm excited about this rather than I'm stressed. We use stressed a lot, right? So somebody, it's teaching.
She froze again.
Yeah. Oh, yeah. She might be. She could be back. Well,
I told you, man. She's smart.
Yeah.
And
how to promote. Am I back?
Oh yeah, you back.
I see so many people that I just wish I had their phone there. I don't want to stalk them. I want to literally pick up this phone and just say, hey, I can see something on your face that tells me you're
one thing I noticed?
You're suffering needlessly.
And I'm not BSing you. I told my wife this. When the Olympics started, the girl Simone, the gymnast, I told my wife something is wrong with her. She doesn't look the same. I think she was so pressured, for winning gold, doing all these commercials, that I don't think she slept, because it was just so much on the plate, And when I feel like when I've been there before, when I was in, I was the All-American. I had to lead the team, and when people put so much pressure on you in her situation, and you don't sleep, and you just worry, because I guarantee you that child didn't sleep, for months heading to the Olympics.
Oh yeah, and I think what she did was it was great to raise I guess some light and awareness on the situation. I mean, when you were just speaking, Julia, you made me think. Even in reflection to a few years ago, that was sort of me in a period where I was, constantly working in the studio, just on the grind, go to sleep for a bit, back up, back to it. And I didn't necessarily think there was anything problematic about it. I wish I I knew Randy a few years back, but I wish I spoke to him about this subject matter probably before that as well. It probably would have saved me some time and stuff. But nonetheless, I see the value and definitely the importance, and I think it's great what you guys are doing, sharing, the knowledge and stuff and putting it out there. You were just speaking about anxiety and excitement just being both sort of sides of the same coin in just terms of the the polarity of it, but just the effect that it has on us and on the body and stuff, which I think is a great point. And I think next time we could definitely lead off from that and probably look at just maybe even some kind of mental alchemy and how they can look at things differently that can help us, shape how we can move forward more positively and healthily and stuff as well. I do have to wind things down, so we got like 6 minutes. They're counting me down, and I don't want us to get booted out again. That's why I'm kind of just, doing it.
Well, I hope people, your fans, all the music fans, the No Limit fans, will go out and get Best Sleep magazine. We need to support this magazine.
Yeah.
It's very important information. And, today I'm dedicating in this program to my boys, Canoe, that, who just passed away, and he's a great little kid. And, but, also we got to think about Biz Marquis, all these very, great entertainers who are just dying, and they're dying from illness. It's like I tell people all the time, with Heavy D, when he was flying back from the UK, if he'd have got tested, he'd have caught that blood clot. His Coumadin level, is too high, and like I said, it's very important because I get criticized a lot. Oh, Swoll, you always talking about, you change, you're different. Well, because I love my community, I love the hip hop community. I love the music, community, just like professional wrestlers. People don't know, a lot of professional wrestlers die, and a lot of them die in their sleep. And that's what happened to Chase Tatum and Brad Armstrong. They both of them died in their sleep, and that's what turned me on to sleep apnea. And plus my good friend Reggie White. When Reggie White, a Hall of Fame NFL football player, when he died, I really got more into sleep apnea. And I was doing a lot about myself until I met Julia. And but like I said, I want people out there to know this is not nothing to play with. This is not a joke. We're very serious. We've had people tell us, sleep is not important. You only need a few hours of rest in your entertainment business.
Exactly.
Now we have somebody with the knowledge that said, hey, that's wrong. That's not the way to do it. And I want to tell Julia, thank you very much, for being on my side. Thank you very much for allowing us to come on your podcast. And I hope that people understand this is not a joke. I know people are gonna say, "Oh, y'all interview is too long." It's too long because it's so important.
To be honest, I didn't even realize the time running up on us so much. So that shows you.
And bring your questions. Bring your questions.
Right.
You know, yes. And if I don't know, I'll find out for you.
Right.
We'll find it out.
Awesome. No, sounds great. It's definitely been a, honest speaking to you guys and stuff. I've learned a tremendous amount, and I'm sure that the listeners will too and stuff as well. I just want to say, what I'm going to take away from this is just to sleep better, because I can't say I'm perfect with my own sleep pattern sometimes myself. Me and Randy, we speak about it sometimes. So is to implement that, and just you gave me a lot to think about on the REM side of stuff as well, so I can do a bit of research on that as well, and just understanding the importance and the value of it. And I can't wait to have you back on next time and stuff as well, and see what else we can explore and uncover.
Thank you so much.
Thank you very much, and y'all have a great day.
Thank you very much.
All right. Is there any way you want to plug where the magazine will be? And
you can get a free digital copy at bestsleepmagazine.com/launch. Okay, bestsleepmagazine.com/launch.
What about if somebody has a question for you, like a sleep apnea question? Where can they go to?
bestsleepmagazine.com/ask. Just ask. Yes.
You got it all figured out. So definitely much love for your time and stuff as well. And
thank you.
I'll catch up with you guys soon.
Thank you so much. Take care.
Thank you, Maria. Have a blessed day. Thank you.
And you sounds all right. Peace.
All right. Bye-bye.
Nice one. Peace, family. Don't forget to like, share, and subscribe, and check us out on outnotonline.com. Don't forget to check us out on Facebook for exclusive playlists and social media for all different types of segments and content.